Well, mental health is just as important as physical health, which is why making sure it's accessible for everyone who needs it is so important. Common Ground is a local nonprofit that is working to meet those needs. They just expanded their behavioral health urgent care. It is now serving people 12 and up. Joining us this morning to talk about the urgent care for mental health is Common Ground and Chief Nursing Officer Heidi Warrington. Good morning.
Good morning.
So tell me a little bit about this urgent care, because we probably have all gone to urgent care for, maybe a cut or something else, but you don't think mental health when you think urgent care.
No, and really the behavioral health urgent care, it's just like a physical health urgent care. However, it's for mental health and behavioral health needs. So something that's not quite severe enough to go to the emergency department, and something that may or may not be able to wait a couple weeks or months to get into a psychiatrist. So we're right in between, and we fill that gap.
Is there a lot of these urgent cares out there, or are you one in just a few? Because this is the first time I've heard of anything like this.
Yeah, there's only a couple other programs, and really we're unique for the state of Michigan.
It sounds unique, which is exciting for those who really need the care, especially teenagers who are going through so much. So what went into the decision to change, I guess, the ages of people seeking help?
Well, we've always had the plan to service all populations. So we started with adults about a year ago, and we just recently expanded to adolescents ages 12 and up. And we plan to expand to children once we get, comfortable with the adolescent population.
And you were saying that change was just made recently.
Yeah, March 1st we opened for adolescents.
And that you've already seen an increase in patients.
Absolutely.
How much?
Well, we've had close to 800 encounters so far. We've had a handful of adolescents, but right now the key is awareness and getting it out to the students, getting it out to the parents, letting them know this resource is available.
So take me through the steps then, the process of when you walk in the front doors, because when you're dealing with something, a mental health crisis, that can be scary to seek treatment.
Yeah, precisely. So there are no doors to walk through because it's a virtual clinic. It's telehealth, so it's discreet,
nice.
Stigma-free. You're at home, you're on your smartphone, and for the parents out there, you're not buckling in 3 kids into the car seat and hustling off to a doctor's appointment. So you can be on your smartphone, you can be on your laptop, and you can be at home, in your car. We get any type of situation. So it's a full telehealth virtual clinic.
What are some of those situations that you're able to treat?
So we see a lot of anxiety, depression, panic disorders, and we also see people that may run out of medications. They either have no psychiatrist, or they just moved here, switched insurance, they're going to run out of meds, or without urgent treatment, they may go into crisis and they want to prevent themselves from going into crisis.
And do you take insurance?
Yes, we take all types of insurance and private pay.
Nice. So especially for teenagers, there has been so much in the news lately with these shootings. It's terrible. It's absolutely heartbreaking. You have what happened at MSU last month. A little bit over a year ago, we had what happened at Oxford High School. Do you treat these teenagers who, maybe not necessarily going through a mental health breakdown, but just are struggling?
Yeah. So mental health was already an issue with adolescents. Pandemic brought it to, an head. Then we had the school shootings that increase the anxiety with our students. And then we have, an increased risk of suicide, which is our LGBTQ population, and they're at higher risk for suicide. So we've got a lot going on with our kids. And I have a transgender son that we've been managing, and I love you, Ray. And this is a resource that I'm bringing to other families that I wish I had many years ago.
Well, thank you for sharing your personal story. Yeah. I'm sure there's a lot of parents out there that would love to hear more from you, would love to learn more about this urgent care. Where can people go to learn more?
It's really easy. So commongroundhelps.org. We've got a phone number to access the clinic. You're going to get a live virtual assistant. And they're going to walk you through the appointment, and it's going to be a human on the other end, so you're not dealing with, the technological difficulties. And then, of course, you can go to our 800 number, and then behavioralhealthurgentcare.org is the actual website for the urgent care.
Heidi, thank you so much for all that you're doing for this community. I am sure that it has to be a big help.
Well, thank you so much for having me, Ellie.
Of course.